listening to Tapped In, Buncombe County's half hour to empower on WRES 100.7 FM in Asheville. Listen up and get tapped into local important resources, information, and topics. Learn more about the topics of today's show at buncombecounty.org. Okay, it's time to get tapped in.
Hello, and season greetings to all those that are listening to my voice. And you know what time it is? It is time to get tapped in. I'm one of your hosts, ZaKiya Rogers.
And I'm Leonard Jones.
And Leonard Jones and I come to you from Communications and Public Engagement Department of Buncombe County, where the heroes wear cape.
Joining us today are two guests, Buncombe County's Economic Service Director, Phillip Hardin, as well as the Income Maintenance Admin, Ian Allen. Beginning December the 1st, 2023, more than 600,000 people in North Carolina will be able to apply for health coverage through the North Carolina Medicaid expansion program. It's estimated about 15,000 eligible Buncombe County individuals may also qualify for this expansion. So we're here to learn more about the Medicaid expansion. So welcome, Phillip and Ian.
Thank you.
All right, so I'm going to ask you guys to tell our listeners just a little bit about yourselves so they know who they're talking to. So I will go with Ian because you're on my right side. So go ahead.
Well, I'm Ian Allen. I've worked in Health and Human Services here in Buncombe County for 10 years and enjoyed being able to help the community out and provide individuals the opportunity to see whether or not they're eligible for the Medicaid programs. Before that, I had 5 years where I was in McDowell County. And but originally, as you probably can tell from my voice, I'm not from down south. I am from Western New York.
Okay.
Yeah, and moved down here away from the snow.
Well, you might get away from the snow, but those leaves are going to follow you all over your yard. Okay, and Phillip.
And I'm Phillip Hardin, and I'm the Economic Services Director for Buncombe County Health and Human Services. And I've worked in social services and for about 36 years now.
Oh, wow.
And been in Buncombe County twice. Worked here from 1989 to 1994 and came back in 2013.
So you've been doing this for 36 years.
Actually, a little bit more. I had 2 years in Georgia too, so about 38 years.
So Phillip started working when he was 5. Now, thank you so much for all of your services that you guys have been providing to our communities all this time. So let's get to it, because we hear so much. We hear Medicaid, Medicare, and we never know what it's called. What is North Carolina Medicaid? Who wants to answer that?
North Carolina Medicaid is a huge program, actually. It provides a broad range. Primarily, it provides full health insurance for individuals. There's a number of programs, whether they be family and children, pregnant women, and the older population of group and disabled. And then expansion is going to even broaden that further. But there's also Medicaid also helps individuals that might have Medicare and need help with their premiums. It helps individuals with family planning and various other more limited services, but it is a very large program that can help many people in our community.
Okay.
There's probably already about 2.4 million people on Medicaid in North Carolina already. And expansion will add to those roles.
So the expansion, and this has been going on, the talks of this has been going on for how long?
About 13 years.
Wow.
Medicaid expansion came about during the Obama administration. A lot of people called it Obamacare in a lot of ways. And states have rolled it out. North Carolina will become the 40th state, I believe, to expand Medicaid.
Okay, well that is awesome. So now that it is expanding, who is eligible?
What it does is it probably single individuals without minor children will probably be the biggest beneficiaries of this, but also working parents in a lot of different ways, because the income limit has been very low for working parents. We cover a lot of children with Medicaid because the income limits are higher. But the parents were not eligible for Medicaid because those income limits are about a fifth of what it was for their child. And so you could end up covering a lot of families' kids, but you weren't able to cover the parents. So you'll see some parents who will be eligible for Medicaid under expansion because that income limit drops from about 1/3 of the federal poverty level to 138% of the federal poverty level.
And so we know that it began in December the 1st. So what if in this year I had previously applied for Medicaid before? What is different now? What do I need to reapply, or is it just an automatic kind of enrollment?
So if you are already approved for a Medicaid program, perhaps you're approved for a partial program like a family planning program, and you're on that, they're gonna automatically see whether you qualify now for the better coverage, the fuller coverage. So in that case, you don't have to do a thing.
Okay.
You're gonna get a letter in the mail that says, hey, you now have this coverage. Now, if you were denied because you were over income or didn't fit the eligibility requirements before, then yeah, we would love to see you apply again. There's a lot of ways to do it. The website epass.nc.gov is an excellent way to get in there and apply for benefits. Individuals can even create an account where they can receive the notices and communication right through that account. So just kind of streamlining things. But yeah, we would love to have individuals come and apply again so that we can see whether they may be eligible for this program.
And what was that website you mentioned again that people could reapply? Or
Yes, it's epass, EPASS.NC for North Carolina, NC.gov.gov.
Oh, wow. So,
And
go ahead.
as Ian mentioned, I think it's important, all those individuals that were on family planning, for the most part, there was 5,600 of them who've already been converted to full Medicaid in Buncombe County as of Friday. And they have actually already been notified.
Okay.
That is awesome, because you a lot of times as parents, they really they're really just worried about their kids. And one thing I've always, when I used to work in different organizations and everything, is tell the parents, you can't take care of your kids if you're not feeling good. So this is great. So now they can get those once a year physicals, or if everyone gets sick, they don't have to worry about where they're going to get their prescription from. So this is excellent. I read that this opens the doors for 19 to 64-year-olds, and we think about a 19-year-old, usually fresh out of high school and maybe going into some kind of technical program or working or college, and sometimes you cannot afford those what they call the cafeteria products of your package. And so this is so good for them, because I've heard so many younger adults say, I just wish I could have health insurance. I have X, Y, and Z going on, and I need health insurance. So are we seeing a lot of folks in that age group coming in, or will it not start until December 1st? Can they pre-apply?
They can actually apply now. They may not be eligible until December the 1st, but they can make an application now, and we would approve them kind of going forward as of December 1st if they meet that eligibility criteria at that point. And let me give you a couple examples, because I think this kind of really helps people understand. In North Carolina, the way it's been in the past, if you didn't have minor children in North Carolina, you're in that age group 19 to 64, as you mentioned, you would have to be declared disabled to be eligible for Medicaid. And that was the piece that really a lot of people could not get past, because that disability determination was done by the same people who do it for Social Security. And so that whole requirement goes away with expansion. So those individuals who maybe could not get Medicaid in the past because they could not get that disability declaration done, they would be eligible under expansion. And on the flip side of that, if you do have minor children, if say you're a family of 4, mom and dad and 2 kids, in the past, the income limit for your children might have been about $3,000 a month or somewhere in that neighborhood, or a little bit more. And we covered your kids, but the income limit for the parents was a little less than $600 a month.
Wow.
So in essence, we covered the kids, but not the parents, because they could not meet that income limit. So those groups at 138%, that income limit starts to mimic what it is for the children under expansion. So we may be able to cover a lot of working parents also.
And I know a lot of people, they're trying to figure out, well, where do these numbers come from? Can you give me just a little data on how those numbers are calculated so that people can understand how we come to these rules and regulations?
Are you talking about like the income
Yeah, the
limits?
income. Yeah, I'm sorry, the income limit.
Those are
yeah.
federal income limits.
Mhm.
They're done at a federal level, and
Mhm.
most income limits for Medicaid are all based on the federal poverty level.
Mhm.
So with expansion, the income limit is 133%
Mhm.
of the federal poverty level.
Yeah.
What is the federal poverty level? Do you know, or?
It depends on the number of
The number of
people.
people.
So
in
if
the
it's a family
household.
of three, like, do you have a guesstimation, or do you know?
For a family of three, under expansion, which is 133%, it actually is a little bit more. If you have earned income, it's 138%, and then we deduct 5% earned income deduction. So
Mhm.
it's somewhere in the neighborhood of a little over $30,000.
Okay.
Yeah, and people are probably like, oh, I probably make too much, and then once you hear that, you're like, hey, because we know that everything, we have all these market rate values for all these things, but we don't have market rate income, and so our incomes look very different, and so that's why we would encourage the community to go out and just, well, not even go out, pick up your smartphone,
Mhm.
because you can do this on your phone with the, what is that website again, Leonard?
It was the epass.nc.gov.
Yeah, and you can upload files from that, on that program, right?
Yep, there's it's called enhancing your account, and if you do that, it will allow you to send and receive information. So it just streamlines. People live busy lives anymore, and to make it into the office and office hours can be more and more difficult. So it's a way that you can get that communication and get what you need in a way that it fits your schedule.
So how are the various ways that an individual can apply?
So other than the website ePass, there's a phone. We can take phone applications. If you call into our switchboard at 828-250-5500. We can also mail you an application if you're the kind of person who just, I need to have that in front of me and I want to fill it out. We can mail one out to you. And you can come to our office during our regular office hours from 8 to 5, Monday through Friday, excluding holidays. We can get you with an individual there at the office to help you to go through that paperwork if you'd like.
And that location for the office is?
It's 40 Cox Avenue, so it's right across from the main bus terminal here in downtown Asheville.
And there is plenty parking, and it is a very nice location as well. So.
And in the parking deck, if you're worried about it, you just bring your ticket in, and if you're applying for services, we can take care of that for you.
Yeah, that is awesome. We were talking about going in and all the different ways you can get your services. What are some of the forms they will need to bring if they're walking in to apply?
So we want to make sure people know they don't have to bring anything.
Yeah.
They can come in and apply. We want to make sure that they know that. Now, if they do bring certain things, it can help the process be more speedy. Or for example, it is an eligibility program, so we do have to check income for individuals. And so if they bring in evidence of that might help speed it along. Proof of where that they live, if they're a Buncombe County resident, that might help speed it along. But we can also get a lot of this information electronically now as well, and we don't want anything to hold people back from applying.
I like that.
And so the best thing people should do, as you mentioned earlier around probably previous denials, is just to reapply again. So we're strongly encouraging people to come out. Well, they can come out now, but beginning December 1st, the eligibility around North Carolina Medicaid has expanded, so we just encourage people to apply in those various ways around online, the epass.nc.gov, phone number, mailing it in, or actually coming to the office at 40 Cox Avenue.
So if you have anything you want to add before we jump into some more questions?
There's one thing that I would like to add. There's open enrollment right now on the federal marketplace for folks. So, we talked about income levels, and there may be some people who are not eligible because their income is. you know, you can apply for health insurance on the federal marketplace right now during open enrollment. And if you're potentially eligible for Medicaid, they will send us, that marketplace will send us an application for Medicaid automatically, and we'll have to determine eligibility. But the other piece about the marketplace, the rules have changed through that marketplace right now, and those stipends are, you know, that people get to help pay for their, are much greater than they used to be.
Wow.
So I think a lot of people have kind of forgotten about that in some ways, and there could be people who are not eligible for Medicaid. Maybe their income is at 200% of the federal poverty level, but they may get enough of a stipend to help offset really most of their costs for buying private health insurance through the marketplace, and their out-of-pocket cost may be $10, $12, $15 a month.
Wow.
And so that's one piece I really would like to mention, because that it has changed over the last couple of years under the Biden administration, and you know, there are better opportunities for people who purchase health insurance also.
Cool.
Also, how is our county preparing for all these new folks to come in and sign up for this? Are we getting more staff? Are we changing hours? Like, what are we doing to prepare?
Well, our commissioners were generous in that they allowed us to hire new staff, and we have added 15 new casework staff, and we added a supervisor and a trainer, because we're going to have to retrain some of our existing Medicaid staff with expansion. I think the point there is people think about Medicaid as being one program, and that's not the case. There's probably 25 different categories of Medicaid, all with different sets of rules and policies and guidelines. And so expansion just adds another category. So we're having to retrain our staff, but you know, especially with the help of our commissioners and our county administration, we were able to hire some more staff. Because I will tell you that our Medicaid rolls swelled during the pandemic.
Oh yes.
And so, you know, our existing staff have been pushed, and but we feel like we're ready.
That is awesome. That's awesome that we were able to increase staff capabilities.
So I know where you said that North Carolina Medicaid was like a health insurance. What exactly does it cover if you just unfamiliar with what Medicaid is? What is covered under Medicaid?
So the full Medicaid programs, they cover basically what you'd expect, like your traditional Blue Cross Blue Shield or United. They cover your regular doctor's visits, your preventative care. They'll cover, you know, if you get sick, immunizations. They'll cover hospitalization. There are a few things that they'll cover transportation if you don't have transportation to and from the doctor. So it's a full product of services that are offered for individuals in their health care.
They also cover dental and behavioral health care. Now, I mentioned dental.
Basic dental. I know. Yeah.
Well,
I know
it will cover any kind of dental expenses. You know, what you run into with Medicaid and dental is there are not a lot of dentists that accept Medicaid, so it may be hard to find a provider. You know, the county or the state has no control over the providers as far as who accepts Medicaid and who doesn't.
Okay.
And so you said something that gears me to another question. I know a lot of times you have to pick a primary care doctor, and we have some folks who probably haven't been to an actual doctor since they were in their parents' care, and now they may be 28, 29, and 30, and may need to look for a doctor. Do they have to establish or have a doctor they're going to see when they apply and they're approved, or are they given like a time?
So that's it's a very good question, because might be used to that or have one. What they do is the Medicaid already has primary care providers who are established, and if an individual doesn't have one, they'll be auto-assigned one. Now that doesn't mean they're stuck with that one. They have a period of about 3 months where they can make changes to their primary care physician that they have, as well as most of Medicaid expansion is going to be in the managed care It's going to be administered through managed care, so they'll be either through Blue Cross Blue Shield or AmeriHealth or United, one of those programs that serves our area. And they'll also have that 90 days to choose which one of those that they would like to go
Okay.
with. And there's it's called the enrollment broker statewide. They're actually contracted with the state. They can give them advice. They can help them with the primary care physician. So all of this information comes to them once eligibility is determined. And that again starts with filling out that application so that we can do that work.
And we went into managed care in the Medicaid program about 2 years ago. And our guess is, not all Medicaid recipients are in managed care, but our guess is the vast majority of people who become eligible for Medicaid under expansion will have a managed care organization that manages their health care, such as Blue Cross or United Healthcare or AmeriHealth.
Okay.
So once you're approved for Medicaid, how long do it last for? Is it like every year you have to reapply, or is it just continuous? How do you?
You have to be recertified every 12 months for the most part.
Okay.
And that goes back to what Ian mentioned about enhanced EPAS accounts.
Mhm.
You can now do your recertifications through EPAS, not just apply, but you can do your recertifications if you enhance your account.
So many great things have come out of, just trial and error. And that e-pass sounds amazing. Cause some of us, we probably remember that back in the day when you had to get all those documents and stuff them in that envelope and either like mail it or drive up to that box and put it in there. And so that e-pass it feels more modern, and it is helping folks to be able to utilize all their time in a day. So, it feels like Buncombe County is on the right side of making sure our community has what it needs.
And you're correct, ZaKiya. And I think what we saw during the pandemic is people really changed their ways about how they interact with us.
Yeah.
What we've seen is a lot less foot traffic. I'll give you an example. Prior to the pandemic, we probably only had EPAS existed prior to the pandemic. For our Medicaid applications, we probably took about 15% of them through EPAS. And today, after the pandemic is somewhat waning, that number is more like 70% of our applications come through EPAS. So people change the behaviors and the way they interact with us as a health and human services organization, and they got used to it and like it. And so, it's really changed the way that we deal with our clients.
Leonard, you got anything?
Yeah, so I just had another question around, like, if you listen to the radio show today, and we done gave out a lot of information, if you still had questions, do you call the office, or do you go to, I know the e-pass is where you fill out your application, but is there just information there, or do I go somewhere else for that type of information? I'm just trying to see if I'm potentially eligible.
There actually is quite a bit of information on the ePass website.
Okay.
So you can go in there and take a look at that. You also can go to, if you're like the internet a lot, you can go to the North Carolina Department of Health and Human Services, NCDHHS website, and there's a whole bunch of information there.
Okay.
But there can be a lot to slog through, so if you're not someone who likes to do that, you can call our call center as well, and they can get you, either answer some simple questions for you or get you in touch with one of the workers. I will say that, like Phillip had mentioned, Medicaid's of many programs all put together, and when you put in an application, you're not applying for expansion, you're applying for Medicaid. Expansion may cover you now, which is a wonderful thing.
Okay.
So if your question is, will I qualify? We're probably not gonna be able to tell you on the phone. Putting in that application, allowing us a chance to see all of the information and how it fits in, we're gonna always look for the best Medicaid program for that individual that we can.
Okay.
So if that's your only question, we're probably not gonna have a solid answer for you. But if you have other questions, we'd be happy to get them for you.
So the best advice is just to apply. Just
Yes.
apply and see where you.
Absolutely. And you can find information about Medicaid on the Buncombe County website also. And if you search under public assistance, it'll bring up the Economic Services Division and all the programs that we administer, because Medicaid is not the only program that we administer. We also administer food assistance and Water First and special assistance and lots of other programs, child care and such.
Well, we are nearing towards the end, and I want to give each of you a moment just to plug in something that you feel is really important that you want our listeners to know. And Ian, I'm going to start with you.
Well, I would just go back to the fact that it's been mentioned many times, apply. If you think that this is a program or a product that would help your family, we would love to have you apply. epass.nc.gov, a great place to go. If you have any questions or you'd like to come down in person, we'd be happy to see you at our office at 40 Cox Avenue.
So, Phil?
Just that we know that expansion will add tremendously to our Medicaid rolls in Buncombe County, and will be a lot of work for our staff, but it's a good thing for the residents of Buncombe County because it gives them access to health care that they've not had in the past. Lots of individuals who've applied and couldn't meet that disability requirement or such. Didn't mean that they didn't have health care issues. This gives them that opportunity that they've not had. So this is a really good thing for the residents of our county.
Leonard?
And again, I'd just like to reinstate a lot of the information that's shared today and just strongly encourage the residents of Buncombe County to go out and apply. This suspension has a great impact on the state. As I mentioned earlier, about 600,000 people now may be eligible, and 15,000 may be eligible here in Buncombe County, and maybe even more. So if you know anyone and they may have been denied in the past, please go out and just apply. As different ways that you can apply, again, is the ePass, it's epass.nc.gov, and as well you can always mail it into the office or come to 40 Cox Avenue downtown 8 to 5 Monday through Friday to see if you are eligible for these new services that's available to our community out there. So we strongly encourage community to apply, and this suspension begins December the 1st, 2023.
Well, all right. So I'm going to go ahead and wrap this up. I want to first thank you all for being here with us and giving this information to our community. I once had someone say to me, how do you know if you haven't tried? And if you tried, what did you learn? So saying that to you all, saying, have you tried to apply? And if you have applied, what has happened? What did you learn? Because that's something you can share with someone else. You know, we often talk about the pandemic like it was 10 years ago, and we are basically on the heels of coming out of that. We learned so much, not only about our community, but about ourselves. There are so many ways to tap into these services. How about in 2024, tapping into our health, mental, physical, and dental? You know, and you may say, I don't need mental health. Sometimes it is okay just to check in with someone. We experienced a pandemic. We have experienced all these different changes, and things have just happened. How about those physicals and all those great things, blood pressure, all that? Because we want all of our folks in Buncombe County to live and thrive, not just live and survive. We want you all to be in a thriving place. So with that being said, if you haven't, how do you know if you haven't tried? And if you tried, what have you learned? From me to you, and until next time, you've been tapped in.
Thank you for listening to Tapped In, Buncombe County's half hour to empower, here on WRES 100.7 FM in Nashville. Learn more about today's topic at buncombecounty.org. Otherwise, stay tuned for more great episodes coming up.